Cases rise in several states across the country. Bars and restaurants are getting at least some of the blame for people not social distancing. But is it the atmosphere or the alcohol that's influencing this bad behavior? Medical reporter Liz Bonus explains.
If I could go back and redo anything, it probably would have been to slow down the opening of bars.
A big announcement this week as COVID cases rise in many southern states. Texas now shutting down many of the bars it had initially allowed to open. Even some bar owners there reportedly catching COVID-19.
When the club opened, and I have a patrons, they like to give me a hug and everything. So they try to give me a hug or shake hand, or maybe they was paying the money, counting the money.
Crowded spaces and close-up friendly faces are being at least partially blamed all across the country for the increase, especially in young people, of COVID-19. But Dr. Kevin Joseph also told me it might have to do with what's commonly referred to as the alcohol effect.
So I think it's really people letting the guard down now that the community is open, not using precautions.
You see, it's estimated, he says, that shortly after you start sipping, your inhibition starts slipping. Alcohol has a direct impact on your brain, specifically the brain cells we use to send messages. So Dr. Joseph says even if you start the afternoon or evening with good intentions to prevent COVID-19,
when you go out and you have a drink, it's very difficult to drink through a mask. And so even if you have one on and you bring it down between sips, at the end of the night or end of the day, dinner, whatever it is, most of the time it's going to be off your face.
As the mask comes down, he says your guard likely comes down too. And before you know it,
we are spreading it from one person to the other.
It's one of the times, he says, where even among friends, it's really okay not to share everything. I'm medical reporter Liz Bonus reporting.